de be hye Erade anemu ewo ne pa ne do ne mobro ho ene adom a ode dom ye ene nso onam sa adom ne so ama ene abeto me ne omienu baby a wo bia ne na ne ye ka che onyankofo se gya ye da wase sanse eyo no de ene nso adom ye hey enti baby a wo hye bia ena onua eja ene adofo baby a wo bia. This is WTV consulting room ade biara da ye de bremo ewo mu fie ene baby a wo hye biara so sene be betumi esua ade a efa yen apomode ho na mpembe bre no mani bi wo hwa obeti ane ese no kwa akwadware o no twahwe eno ano no anase no de queue mumpo anase or drive ye hu ya ne se car na e mane ye kwhwa na ne ebesiesie de ni do hospital ye si ase ne ho ye ase wo se de ne intensive unit ase wo se ye say emma no aso e de important and de sa no me bi a taking ye by surprises yi bi eba ene onyame ede ene da yi nso adon ye no na wo se yesua de esanse for lack of knowledge like we all know my people perish. This is God's word enti say onyankopon asem de a ene ne ye be kan ne sen ye be si ne sen ya anye sitie ensua ade ne na chese asodin ene ehun sunsanso no ena ebeto ye onyankopon pe ne se be ba ne sa nyumosomo de ba bale na kan no he woni menek bi ne le ho work pay ye bi ne boni afe no nye no wakase limpi ne ball akeke won kase ne nka bo fen wakase yo nti se wo asembisa ana se opese wo share experiences bi esane a wafemu ne a wate ya en chese ye hyase a emre beso ye be ma wo ho kwan se ne be ya wo so ubetumi ede won sem no aba eno nti this is WTV consulting room Rose Aduful woni aba enne so ye wo ha ye besua ade me sheda ena menka ho hwe no ba erinche samba I'll introduce to you the guests for our discussion and then for that matter the topic enne ye no enti me da se bebre fra nyonko na fra wadofo se unya ba Rose Aduful ya betna se enti enche ye besamba bio nyame nchara bebre.
Meye mi fie Christian fie mema mi kun aye Christian ni na me mofra aye Christian fo mema mi fie aye Christian fie ban papam eye dwumadi a ekoso ewo WTV so kasa afa ekwaya ye tete ye mofra ekwanya yebefa so ama yaware ayefe ne yaware edimu efie entete anase efie siesie ene efie nkomodie mu nso yenya ento nchen into me to sa frɛw sɛ hwɛ WTV na nneɛma pa bebree ɛwɔ WTV so enwumpa nkomodie papa nneɛma pa ɛbɛboa me ne omienu ene yemfie kɔso ara na hwɛ WTV.
Nyansa ashese onyinyamishu. Let the little children come to me and do not hinder them. Matthew chapter 19 verse 14. Oh yes, let the little children join hands with WTV every Sunday for a special children's service with the Methodist Church Ghana at 10 a.m. with a repeat at 2 p.m. on WTV and Facebook. Nyasa ashese onyinyamishu. Wesleyan Television, reaching out to the world.
Yeah, damasi bebre nyame enshiramo Aduful se motimi enya wotere atwen ye na ene ye nkomodie no meni abema ba ko a onyankopon de no adomi ewo hase na wade ye she aseni edi nkomo na obehu se ene die chese reka asantimu asantu papa na enenti nyame dom mewo Dr. 𝗥cieះ𝘂𝘂𝗶𝗴 Dr. 𝗥cieះ𝘂𝘂𝗶𝗴 and your topic na you share about stroke. You share about stroke because social nancy ya enkan yes you be nya stroke na ye wo nana anase me nana obi a wenyi ache and na onya stroke. But see the question is what is happening? What are we not really doing well, or what are we not getting it right? Dintina, as young as you can imagine, you see, oh, when you're stroke, you see, oh, I am near no more. And no need no mic account because soon so be your stroke and your patients nipe and your yare nipe it affects literally obi biara. I was seeing your caregiver, I was seeing your ebusian phone, obi jai, juma no to me, a shannon near the day when you na issues I affect ebusian. San affect just income maybe because diversion baby resources no say was say to me DB a share a manage a long-term condition I wo onua nche anything na ye discuss about stroke no na yenua bema Dr. 𝗥cieះ𝘂𝘂𝗶𝗴 if you Ikolebu Teaching Hospital or stroke unit on Dr. 𝗥cie mepacho mema akwaba
medasi p
and menia jibebre se and wabeka yen ho e wo hase eye emritiawa ene de frɛ wo nemo aye manije and the entire crew and the members of Adobe TV yes yeni eso bebre with the ansana ever share your questions last year Dr. 𝗥cie how has it been with you stroke units like your personal experience and now be on this age that level now how has the feeling been like and sana ya so ask these questions where
it's been a different feeling as in a day and so I for be bawa brabo when ma was sa the way I would dream how obi we say first no na brabo di kind no not a very active or a very strong but all of a sudden then the life assassin because of yare friend no stroke for friend say no ho adwojo na say ne fa adwojo na say ontumi nkasa obi or very active and emma also show ho so ye we ma weni ba wa ho den ho ne wa pomudie ho ene we didie o sorry anopa even though we enye stroke ye yare echi obi a on nanti anaso onye bibi etumi chi obi a nti emma also okay kan ho wa pomudie ho nti yeah basically me feeling here say ama me ho aba me ho so ama me bia me bia I think about it a lot my food my routine that's basically how it has been so far.
I am excited. Really, thank you for sharing that experience because the fact say about so crano and you know it even helps you to draw closer to your God because when you say Charlie say ye nina mi don't be keke and I hear that so and so I'm happy you have shared this experience of consciousness in your life and then every aspect of your lifestyle and as a living. Na doctor ebia ansana we can about stroke no so say bia chi obia betimi na sa na afi ya koso ebia no a me ya can stroke so ya can so bi ho adwodwo and as a nifi bi adwodwo no na dem pa na e pa chire.
Okay, so first of all I want to thank everyone wetiefo nyina mbese me do mase say ene die mo afra me say membe ka stroke ho asem menije pa ana mbese me chia me namfo nyina omofi omohwe me sisamre nyina me chia omo nyina na me da was for support na odi ama me no mbese me chia ye penyi owo stroke unit friend sisia Dr. Fifi Dodu and sisia or act as head and or friend say o me mbese na nan mu ha sei nti first of all me da na sisia o mama konyawe and I'm so me da we director of stroke unit. Yeah, Madam Monica, Madam Asipa, so also, okay, so open as I say, member, member chenko for about yari friend stroke no. Inti Madam team for you know, me chiobia, me roommates, you know, me chiobia. Yeah.
Oh, so yeah, Dr. Fifi don't do any Madam Monica,
Director Monica,
Director Monica, Unyankopo Inshiramu Bibre, sure, Nyamishiramu, right? It's na ye can stroke.
So stroke yeah, yaria. I feel the eba wo. Menka se ye ni ba ho pa wo. Ewo ye fa ewo Ghana ha say, and I say the whole West Africa country, you know, any ba ho pa because it's becoming a lot. I say first, no, maybe in a year they could almost to me have maybe nipa base 20 have a stroke, but now the rates are for have a stroke no. First no man make okay was say area na e dwen say e chimpenyufo obia wonyina nfia konenim, but this year no etumi chi obia from the ages of even 20 going. So yeni abaho ana I say the medical field now we are very active. In the last month say yeah tour as you say the can stroke ho asem.
That's great.
Yes, it's called October for neuro. Yeah, the can adjun ho asem or the brain is into even I think say last 2 weeks you call nam choco environment. Walk, the placards echo around Choco announcing the awareness of stroke. And screening cry, call for BP nim, call for near maybe ewo kolebu.
Okay.
Because now we've seen that the basic thing to tackle is from the root. And call for as in man call for say BBC wo AC. And then yes we answer. To me now young boy now life in asasa. Inti stroke ye bastro ana meba stroke ye yare efe no njojo ye hu so bi hu adwojo no ne fa adwojo no ana maybe obeka say oh wanya stroke ana na adweme ba say wanya stroke yare a esi wo ya adwemu ye wo tem bia ye use wo brofum say brain attack I say wo heart attack no ye fe bi stroke as brain attack esi say moja ekoya adwemu no entumi nko ebesi anase ntini na ede moja kwa ya adwum ne be pai e wa adwun ama moja anwunu wo adwun nim nti that's what you can say obi enya stroke sane kan no
it is just say entina e wo adwun na moja ne na mu no e pai
na say sia okay then na nipa kwa no ho dwun
either say e be pai ana say emu besi
emu.
Wow.
Yeah, that's the right thing. Either say be pie and I say it won't be see.
Inti so wo fanesa na chese ye beka se ebia den ena edeba ena ebetumi apai anase ansa na emu betumi esi no den edeba.
Yeah, me that's pa. So ewo medical field ni mu no yemfa yenhu ade pote pa etumi course ade efe no introduce no ba ye won niam bia ene introduce ne nam anase efre introduce ne ba bofo beka no nka say risk factors edo to baby a ye first our chances so benya stroke no high inti ebi ni say or pressure obi a pressure was soro and I work from pa nti ubetumi nya emu bia be dida say nti ni be pai and say nti ni mu be moja ntumi enko ebi a wo say ekọ because moja wakoma no ntumi mbo ti say wo say ebo no and ye wo say obi ho na wakoma yare ye ka so obi wakoma yare nti pa je say bibi wakoma ni ma ema akoma no ema moja na wakoma ne tumi bontoa if bonu be kan say clot.
Okay.
Yes, it is akoma ne bossa na saa ntoa no tumi eshuti kwa adwenim na akosi intini no esi mu kwan no saa because ntoa awobon keteketiti saa akoma ne bo a He said because all problem with akoma nintino ema moja to me dawa akoma nim. Ye odie almost a cholesterol obu ha ne cholesterol was ro. Cholesterol was suban bia otumi tare ye ntini no emu. Ayese o plaster emu no. Nti otumi me emu ni si ana emu no ye kitikite. Nti yesa na moja ni ntumi ye den emfa on ye den enko adwenim. Nti cholesterol so ye ade etumi o cholesterol was ra etumi cause stroke. Ye wo yare bi wo ho a eye ntini ho yare. Aha yetse bu mo HIV say no mutumi nya ntini ho yare ntini ni tumi ehono ha nti sankofo no mutumi nya stroke. Ye wo yare bi wo so a ye ntini no ene de ye ntumi nchirem obu a free the way you ball and I said the way I want no styles and nyame no nti eno the sini say omuntini ni to me ehuru balloons I say ehuru aye balloon wa adwini nim
na sa na ye de ball wo mo
eto bia it's genetic. It's like you can't usually explain it ha nti abo balloon nti a little pressure and I say stress and I say niyem hye and I bibi boni timi betumi ama sa balloon na eden apai e pai sa na moja betumi nwuno gu ntimi betumi nya stroke enyema bi wo so ayentumi nchirem pi nimdie wo ewo ne limit betumi kasa nimdie no endu ho nti ba enyema bi wo so etumi cause stroke a yentumi enchirechirem nti sana stroke enyema etumi fa Emma wunya stroke.
Doctor Dase, enti say afei no abeka ye ho abebia wo bia no ene we WTV consulting room aye de brewo ewo fie na ene onyame adome ye ne Dr. Akwesi dakwa ena ye twetwe enkomo our 𝗟𝗩𝗪 medical officer our 𝗟𝗩𝗪 teaching hospital stroke unit precisely and ye share about stroke ndudue say wofa dudu ana say nipedue ni nyina right dudu and na or tre normal itumi edeba like say ye odwinga say ye the way in the buy but at least wambo no maybe so or kasese ebia na o BP blood pressure high and I say very lower obetumi ewie usa and I say na by virtue of genetic being or say bibi say balloons brain nimu enti and so betumi apai and I say bia cholesterol kwa and so higher esan say ma to kronimu nketwa enti and so betumi na osan kan say bia na wo moja ni bi clots right
awo akuma
yarea good enti say afi no abeka ye ho awonti ena me masa samwe say nebeya you can catch up with us that way to me ebisa or questions ne or experiences so that you can share enti doctor ye go so ye twetwe nkomo ye no na do we then have types of stroke and as a stroke be stroke
oh there be your types
okay
your enso ngane twika word ne be ye won chichemu and I say your different types of stroke even ejina eno so na boa mayehu how ye betumi ahwe nipa kro no ye shada stroke bia ye treat stroke bia in the same way depending on the time and the type so
depending on
the time the person reports and the type so yes
so
mecheche inti say ye wo obi a inti stroke ne nchichemu ne ye wo de amekan say inti ni mu asi ana say inti na pai and two types the stroke no ye wo brofa no infarctive stroke or ischemic stroke and the inti na pai for hemorrhagic stroke.
Yeah, intina
apa no your friend hemorrhagic stroke and the intini mbesi no your friend and I say moja ntumi nko your friend infarctive stroke and I say ischemic stroke that na mbaka obrofum eno ho and ejina time a obe report so hospital any ye behwe stroke no ebu ho a time a stroke ni besi no mu hu nti no ye beka say maybe ebro 3 months it make us a chronic stroke as a ache influence how you be treating the backro ye what ye see na maybe within 2 weeks he reported to the hospital you found acute but for any friend no inimanimu na obaye nti that kind of stroke no treatment approaching it different and here wo nkofo no more in between 2 weeks and because 1 month, let's expand ourselves 1 month to 3 months no you have omono you form subacute I say omo chronic omo so omo nye acute until omo no you have subacute stroke until that's the means that's with the timing and with the type until depending on the type it influences your treatment and also a try how a patient able to me in a survival and I say because the way you ne be kono and obe free area ni mu no ebi chances so say ebi so obi ba with the intinia pie na compared to obi a intinia si na the pie no omo area no nim kwana so omo free area ni mu no ebe ka say e wo low compared to the intinia si no Into basically those are the types and based on
until like so usually now cassette is saying so be what chronic
yeah
that is they be a when you stroke no for
but
some time
yes where who stroke one say adrenal very beautiful nyame hu yeah adrenal very beautiful organ baby ani baby adrenal ye juma and adrenaline so you can say a healing ho one thing I was see ho no adrenaline one a healing ho and one a healing ho say nya injury be one a healing ho ebi mutumi nya small moja say moja ni be see but ebi e see ye no enya de a e de nsusan so bia ba na bra bomu a wan hu ban e see ye ye twa picture bi wo three na etumi hu say e see da but we who san yesu maybe the kasa sa kakra but ba na odwen say no ayemre ana oyemre no dampen for some time adrenal heal fast because na enye kese nti we who say obibi we who say maybe malaria no ayemre keke ne fa ayemre keke o 2 weeks 3 weeks ne ho ato no nti we who say we nya stroke nti ye twa picture bi wo ye friend no CT scan wo brofum and I say MRI or brofuma e ma etumi hu say maybe nipa ko no nya stroke no 3 months ago and I check etumi hu nti ye obisa ho
oh nti sometimes be to me ehu bibi ade ni di nkoma say wo ni say o say onipa we ni kasa nsheda insisi so but onam ne normal like later be one say no a picky boom it could be say ebiana there has been such an occurrence in the brain
but the brain healed itself and maybe nipa kona to me hu so we are one abrabo minti of an wamba hospital
okay
until more your chronic type no
okay nti doctor we dey gusu ye kanona ye betumi a share about na earlier on maybe sa course no ye show say kano like I started say ebia na obi benya stroke na obi animfie ewo enimu basisia as young as you mentioned to say 20 and as a little about 20 it may enya stroke what exactly could be the reason entiana sisia sa age range no anase bia wo statistics age range no aba from sa no
so yes question where adia ye kwa ye medical field ye busa ye ho yes because a new trend and that's what I'm saying is bringing Maya more conscious about stroke and we've not limited our mind to say old and sanobenya stroke the young can have it and now people are paying more attention they are doing a lot of research into that field to ascertain to know why then you say on question no nti ama obia ask that question na ye hwehwemu ahwe ni enti e de aba but the way to me aka say sisia no the yehu bebre ni say the young are getting more being diagnosed of hypertension omunya kidney issues the one say obi benya akola benya na me say young boy benya kidney issues either say from herbal medication be or and say some drugs tramadol some abusing tea enum no omutumi nya consequence with hypertension which give them the chance of getting stroke and yeah enhwemo nkophobia ye and I make say stroke no yen sheda hu say we need to me cause stroke but to me hu say enema bi and our lifestyle be put here as at 𝗟𝗓𝗩𝗘 ebi mu try to relate the use of sexual enhancement drugs to say Viagra ne the keka because enhwehwemu no actually say etu enye say etumi cause but put you at risk because etumi cause some effect to yentini unze bema be sorry yentini hu adwuma and as yentini na bia na wa adwenim enti eduro no ye yentini hu adwuma enti etumi the way etumi cause moja to be ko adwenim bebre na say cause ma vessels near den be vasospasms I say contracting a jai
and was senke
and was say yes sir enti but we've not knows that and on a course ya na say means me say chinchina Viagra to me cause stroke but it to me put you at a risk if you have other conditions say pressure was so one shredder was a young boy and the pressure unim yes obu a young boy na mona on the pressure nam over 150 but unim because on na more or corner ba hustling or corner ba nti ohu na akofa Viagra na young nti enu nyina uwa bibi wo ho a cause issues nti etumi de sanya maneba nti ehwehwemu a ekoso na me bompa say nyame bebie ye doctors for ye niama yehu na etumi esi ho anokwan yes
emra nyame ebie ye ni so senka ye so kwa betumi asachira wo
yes betumi asa
say ye aggressive the young ones no ye ma ho gaba bibia ye pese ye bi e pese
ye bende
ya me sure say wo ka basa herbal preparations na say say yes medical and I say you can say is it medical treatment
medical
yes e wo ho no mo but we be ka so medium num e bibidru a e na ye mame na say ye no mani advert bi e be wo TV so ye beto ho edru baby biara ye bet no ye be ko ho no mo enti asem na ya asem we there I really believe say yeah ye wo ensori mu ene ebusia we ye see it me ye mofra and the young ones of today edi enkomo about this one nyame ensure bebre and say ye kenyina no aso se wo can say bia pressure ni bi wo ho ana enti na wo adwemo no ebe pa wo kan say ebi nso wo hana esi ni ade no wo be siden ehu say is it possible say ebia wo nami ubetumi ehu anasa be feel say me ye stroke is it possible
so online and to say
warning signs
yes so we have warning signs but you personally won't see it's quite an interesting it's not like heart attack they to me say wakoma I say wakoma ni meow and I will be the track be boso you feel it but with brain no I carry a friend brain attack or stroke no you know even the type that you are having unless say you are brony image na make us CT and I say depending on the time abeba no CT and so you say okay o the emoji na pie na say emoji na nis but you won niam bia etuma hu say enkoye me ho there be o say ye and I say ebusuafo nyina yesua because obu ohu ana meka no obu ana wo hu se na no achia but the only time obu se wano achia se wo kasa na wo sere na yeso yen kasa fa ye phone mirror ngina enim enhwe enim nti ni bakwa na one ni di nkomo no ono betimi aka se sweetheart wano na ye den achia kofa ma me yen ko hospital ni yen ko hwe de ekoso ana se ubo hu se unsa no me kind me patient be ono say not all drive it or yeah drive very long distance so or usually or you see the left hand no eso steer nim that's what on told or the so no waja ne saba ko ne dey for Nigeria control nti ohun say afi de ne nsa no or da so steer nim but on feel say asom no force no ntiase eso no drive car no on tiase no ka say inti na da 14 nchen na ka che ne say o dan ne no say chale mensa no me I don't understand who say wano no asa achia o no say mano achia say wano achia no ka say wano achia no say we dey yen driving call into no one driving ho e call hospital with the left hand no inti eyo bi na hu say o maybe wa shada na o kasa say na no ne kasa o kasa na wa chia na no a ana na da for the fan so obetuma kofie na by the time obedu fie no na aye west nti ono no driving no na dan for no so dey yen for hospital na ye nhwem na me dem nji de na akasa mano achia na miminsa nti okọ na dan for car say there be onya stroke but ono no time no quite very good from time I not driving no kofie no for hospital nti just that na ne de ne de moja na nti na den apai it is on called kofie anka ye be say oda sorry and wan den wanyane odidi e obetumi because I left nko betumi ne nsa nifa na didi edi nkomo ba na no achia na akoda maybe obedu fie na ade asa na yiri hu nanim ye wada ye betie ni no ne aka say okodwuma ba yo ba wan dance sorry nti there are warning signs say na no achia wo fa wo se wo fa ayemre nti wo fa ayemre wano achia o kasa sesa kasa no first obi onim okasa bebre afi de okubusa na sema no waka nsem mienu baako da bi enye sa na nesutie obi obusa na se ho te se mi hu ye na wo so onka se
okay inti me ma omo be show I think normal will can be
yes.
I think say now will can about
yes.
Anon.
Yes, you have Anon. You have that's a face and if you can face F you'll be fast. Are there you use for your campaign? Inti your balance. Ubu ha or sorry say or nantiakwa. Boze no achiako fa. And yes, yes or target. You because say or target there be koso. Until when the balance assessment. Obu also be say ne balance as ba obu also hu obedwen obu so dragging if una be ka say watch ya o tie no watch ya kofa obu on ni edi nti obegine obedwen say wa yemre keke obu say ne ni ohun ade ye ne ni so ani tum ne ni so brino bibisa ana say wano achia ne mekan no won sa yemre wona yemre wa otumi so ana me ka say madam for hu say on to me so steer ni we no say na ba no say na bibi koso nti okọ hospital ntem ni to me so ano ntem ana ye wo code be uhu sa ndem we so fresh o friend animanim na 112 12 short code on develop for stroke o friend tema e be boa yen o frepe is a hotline when you call they will just I think an ambulance service will be made available to you and you'll be wheeled to the emergency. I think that the people who have this emergency team, I think there are 2 hospitals. I think it's 𝗟𝗓𝗪 and Komfanoche, who have equipped themselves to be called, and there's a team waiting for the stroke. Yes.
Oh, okay. Ashefo ene Aduful near Dr. Dakwa Echre ene say sa symptoms yeah na no warning signs na symptoms no me bia ebi wo ho a wan kasa po ahyase no hu obi na be fair attention to it near all trace bia na senior wonante suddenly asesa kakwa anase ebia senior weni ehwe ade wo feel say weni su ye kusukusu na one day suddenly senior wo hu ade no asesa na se wonsa eye ajoju kakwa anase wo kasa no kra no afi enye senior wo kasa na wonim no sa na eye ase wo kasa wo twitwimu anase aye speech aye is it slay kakwa no na o kasa anase o kasa kakra bi enso enka no enye sa na kasa yes enti ne doctor echire ne se bedie nyame adom ye wo omo code right
yes.
I'll be to me afrose 112 se wo kumase ne environs any enkran enti kumase de confirm no che na enkran ye kolibu onya dialysis number na odon for beba any ambulance na yetumi aboa o entem de wo akọ hospital because enka obi enya nka onhwere ndofosa emfa stroke ho enti let's take this opportunity and these lessons say ne be ya yebetumi aboa ye ho right enti doctor okay it's the aspect of the timeliness to in response to this warning sign or any more code na mode atudwa no also 112 and no eboa to intervene immediately.
It helps with eboa prognosis but no prognosis your timing depend on the timing and so influence your intervention between ya eboa oba later hard drink kakra oba ntema eboa nti it and a tray dey betumi ayama depend on the stroke and make one sem no it depend the type yeah na aka say the emosi ni the apai no see to me determine ntema a tray ekwan betumi afa so ayeden aboa ye patient no
even in tema eboa mu hu senyo betime aboa mu so nti papa ye di nkombo ende na ye nhwe once sometimes bi o stroke no ye beka say obi die eye general na ebi nso ye nafa na afa no cry bi wo ho si o we de ne aye no otumi kasa de so ye bi ene wo eno so
okay so adreno ye na make a very beautiful make out a very beautiful organ
sure.
Yes so adreno nyame de ya nyame ye ne say ewo family nu your left and a right nyame nim die mu no left side no control your right side and a right side no control your left side asesa nyame swap no kan say wo me gada say banku ne control nifa control bankum ewo adrenim sanity enti ana it depende
okay that's answer na better so I think say earlier on now we can about types
yes so there's the types enti no mature ho no
se ne be appreciate
yes enti the emosi no o show nsa bankum ne so a la first picture now okay listeners about monsenifa into monsenifa so utumi hu say baby asi ewo intini pipe nim and your friend ischemic stroke and e wo dey apai no
yes baby
moja free pipe nim ye den eba this are normal tray there were two types right,
yes into using this concept so now about the parts of the brain
into brain na make sure no okay we fa we kwa picture ne kire say fa na ye hu no your next fa no so ho into emienu into baby a na nyame nimdie mu no or the baby etumi kasa no obia emfa ne so ye bankum ye nifa baby a utumi kasa ne ye adwen na ye bankum no that's your left brain and now your left part of the brain controls and control ability so betumi akasa inti so binya stroke on the left ne nifa na jojo ba ontumi nkasa
because the left brain is controlling the speech
and the ability to talk or express on to be kasa no Inti but obinya stroke on the right obetumi akasa. Inti ubaka ade na way to me kasa na way to right in control speech.
It's in the left bedroom
Jojo but obetumi aiden akasa. Inti by etobia they have a little bit but otumi kasa compared to obia ni stroke age na baby a stroke ni be den ebesi obu also a stroke no obetumi nya mienu che okasa ne fa mienu nyina akọ ebetumi esi wo en fa ze esi wo left entumi ebetumi akọ ebetumi asan si wo right nti obetumi nya mienu na afi de o fa ni nyina yeden akọ na hu nyina adwojo nti sana stroke tie se peculiar obu ho a onte se uti no ejina bebi a stroke ni siye onte obu ho a obetumi move inside but the saying on to me moving obete uti na obete
on to me move ba uti
na obete se weti no because baby a stroke ni siye no etumi spare baby a obetumi atenka nti otenka but on to me moving inside no henti baby a stroke ni besi no na be kire how anipa ko ne be ensusanso obehu ye behu onimu obu wo so a stroke ni si a ohun de ekoso on the left say obebo na sunko afi ni left a ohun onim say the left cry the left side na exist
on yes sensitive
on yes he doesn't know so Janet in the left obeka say begina na right in the zango for na ka say obinya stroke onko eye test nkwohwe nani because on to me eto bia maybe also drive or technical right no right no just go straight no akopem because stroke ni have the ability to be see no ohun ni fanes ohun baby be ekoso ni nifa bia and ohun de ekoso ni nti baby be si no na be kire obu a stroke ni si wo ne adwene wo baby a nke ti obu a your fair baby frontal lobe esi wo tumi sisa ni su obu a na on kasa basa but onya stroke afi de ensem bia na efira no ba yes maybe obu a maybe atena bro chire pen onka bibi sada on didi atemda afi de onya stroke a obi na no didi atem no kan sem bi unse mfata ni su enatie on kasa sa
nti na chese
etime sesa usu
and this is the frontal lobe.
Yes, it depends on where it will occur. A see or obiani do how be appear into because me there onya stroke no ntisa no ye calm no ye din obu ozo no ye gidi onya stroke no beda din because of baby a see no it baby a stroke ni be si na be kire how wo so be hu ye be hu stroke mana the complications we see or the signs we see in you.
And doctor, usually say, their relatives near the ebam ho. Do you tell us all these? Because I'm asking this because it be a while, like you're saying, we don't really know. But psychologically, because I'm taking care of this person who is now so dependent on me, now we are beginning to think, say, you're not being supportive. Say, Dano, and see, DNA say, Nane mano or bo money and yes, that do you really take us through these changes that these times you're talking about?
So now there is a new change. Doctors now we explain. Now doctors we explain a lot.
Explain a lot to us.
The new training, new things coming up has made a lot of doctors have time to talk to their patient relative and prepare them for stroke. Especially, I can vouch that we even sit the relative. We have a place where we sit them down, we talk to them because stroke treatment is expensive, as you said. It's draining. Your friend is more. You use a multidisciplinary approach in that. Obi a team play and your doctor nkwa and your nurse nkwa who abuseni no me catch me patient relative who abuseni play 50%. Yeah, maybe 30 be na next one other be 20, but no, half of what will happen depends on you. And if I catch me patient say 50 need na homa or finances. Financial is first because the habitual drama, you be here so be active. Physical presence. Your physical presence is very necessary. You hear what
your caregivers,
the relative. We tell them that your physical, your five things. We tell them financial is the first key because we need your help with the finance. When we say we need this, it has to be done. Then your physical presence is necessary. You can't just be sitting in Accra or let's say sit down somewhere now. Go down yeah for now for the no. It changes your whole routine as a relative. If your relative if you have experienced someone who have had a stroke, it changes your whole routine. If maybe you were going for 9 shifts, you have to change to morning shifts. If you were doing work in Kumasi, you have to move, relocate. It changes your physical pain is necessary for the patient. Then your emotional is part. Then the spiritual aspect, your prayers. It's not easy. You need to be very you have to get close to God because in prayers, because it's not any may catch on say any straight line. And you say share donuts now no. Yes, it can take a different turn. It can take which our knowledge doesn't get there. So some form of, if you believe in God, you have to keep praying and hope and be hopeful.
And I love that one.
Yes.
Because no money be why na as a ye de twetwe ye nan ase kakwa.
Yes.
You na ye pese obi e corporate need in corporate camp na de pese wan kasa.
Yes.
It is you who now appreciate it and that God. So I like it say if you believe in your God, then you have to pray.
You have to add prayers to it.
I love that.
Yes. And I think the fifth one will be yourself. You have to be strong.
So the finance, your presence, your emotions, your spiritual,
and you.
Yourself.
We need you to be sensitive to yourself. You can't just be walking about and we'll have another emergency from you.
No, but of course it is difficult.
Especially
on the part of yourself.
Yes.
Because this is the look at it, there has been relocation.
Yes.
Finances have been affected.
Yes.
Attentions have been diverted.
Yes.
And then now you're also saying, say, me, myself, how do I take care of myself?
So that's the point.
You know the state in 𝗟𝗓𝗡.
It's serious. It's not, and stroke is serious. The treatment, because you see, it can take any turn. So they be a so soldiers. We don't leave anything to chance. You say maybe we are always paying attention. At the stroke unit, NAFN stroke unit, we are always on our feet with the patient because anything can happen at any time. Maybe the first he could swallow, but in 30 minutes time he can't swallow until so we pay attention. They be command in so crown no otuminum so sha se ketua bi ekwa na okay otumimi na de ye ntoaso nti we pay attention very serious. So 50% no is very necessary. You yourself is needed. So yes, we explain, because say yebenya ye patient who atone here ye hia say relative no bet say yare na say na otumi de ahode na den ehia yen because say ono ye betu abekasa ye betumi abetra to ho say relative na ahode no enhia yen we are not helping. Then exactly we usually either we go for social welfare of the hospital. Yes, why you juma okole we won say easy sir. So ana to be doctors for na yom sika bottom sika or the ento bibi mano, but yen to mean to also because of their form of responsibility elsewhere. So relatives are made to really understand. We take our time. And yet so yes I'm sure say it me catch them say it depending nipa krono it bet me catch us say oh ebekoye enkoye nti yemboa ya ho ahyase na ye mbe ma won feel say oh ye ho odian na afi de all of a sudden no nti ye no we team ye teammate e say ma won say ne ye ko say na ball ha e was say kirew untumi nka say wone me bobo na afi wa bobo say me nkomrika da bida no e was say me no me nu what the same pace nti ye kirew mo say na e ko bibia say betumi esi ana say betumi akosi emu e pese mu anhu nti enimanimu na omo ne ye wo the relationship say a dog ekosen ene de eye ekosen na ye no mu di nkomo nti yes now I think doctors are and I think it's occurring at every site. Yes, now you catch them from the beginning.
That's good. It is a munkomodi it's not just like a one-time thing.
No.
It's like
periodic. We are already always ready. We move together. It's a team play.
Part of the
yes. Even when one surprising thing that people even know is that when we are discharging our patient, we first have to ask permission from the relative. Are you ready? We have to get you ready to accept.
To do that kind of continuity of care at home.
So we have to know if you are ready. We will take you through training.
That's great.
So it's not we just discharge and leave the patient on you. Now things have changed. Now doctors, let's say most doctors are being more sensitive to relatives.
I like this one.
Yes. Yeah. To me, feel it because I'm it's
true.
Yeah. So now we don't play with anything. If anybody is spending any money, pay. Yeah, but any person spending because it's not easy to come by nowadays to someone to raise maybe 1,000 cedis to go and buy a medication. Every day he's buying medication and it's not easy. Yeah. So. Now we don't take chances at all. We move with the relatives. Yeah.
Doctor, at the point you mentioned a multidisciplinary approach to the management or the care of the patient. At what point do you bring the is it physiotherapists? At what point do you bring them on board? Is it like while they still on admission, and I say when they have gone home or about to going home?
Okay.
When do you bring them
so
into
with the
discussion?
It's not only physiotherapists. We bring a lot of people on board. We work with the psychiatry, especially because we have the mind, because the mind and the psychiatry people know are all part of the team because maybe on himself stroke there when you there within them into nabamabu.
You know, last week na ye about disability. I think we'll come to the aspect of the complications and like you say, because na ohune say or juma certainly why dependent on ubi.
Yes.
That alone.
So the team consists of a lot of people depending on is patient specific. Patients bia one a set of people in here and I make an your psychiatry do sha dream mu and I make say or dream say didn't them or hunim there say me say minim stroke hunim there pa it may be minya stroke I am rebel say hey me na minya stroke into then also be ban obe shame crying say be ye obe motivate me or tie me how no only dim common we have those people on the team we your physio for na come ho asem no your food and nutrition na make no obu ha ni sugar was straw ni BP aduane cholesterol into your food and nutritionist or more on the ground to always monitor and I want say and I make first obu ntumi mene ade nti the pipe fa ni hunim koto ni yem san kofo ni nyina omoduane sesa because isi ana beye nsuo nti I say enya food and nutritionist or betumi am a correct diet, balanced diet economy betumi aboa na ma nya na hoden ha ne ye speech nti nkofo maybe omkasa na aye basa kakra no ye we invite speech they from the linguistic specialist for ne ba emamu no be din komo be chrom small syllables o kabi kaba.
You don't say.
Yes. So we bring all those people on board depend on the person. We can bring the renal team. Obu no kidney ready that and onya stroke renal team for beba. Obu also a moja the way you go ni team no. E wo see involve kofono operation, adwin operation, neurosurgeons for beba. Inti it's a complex team depending on the patient. So depending on you, if we need to start something on the ward, we'll start it immediately. So physio for baby say once you hear say physio come, physio start. We like doctor now say coordinator and also a chorister. Auto to that's what we do. Inti physio mumbra na physio aba. Diet mumbra shama na diet for aba. Speech mumbra patient psychiatry here more. Neurosurgeons here more. So renal here more. DBL orthopedic, whatever the patient needs, we call people on board. So that's how it works at the stroke unit.
These role players are like
are readily available on standby when they are called.
As and when
they are called, they attend. Yeah, because we need to stabilize the patient. For someone whose BPs are high, you can't be turning the person in bed. Obu clot one in naimu, yentumi. Obu clot one in komu or say. I say invite to be man be chance and I catch a moving the corner. Inti. Yeah, I say about green light, no. I say the coordinators of the whole show.
The whole game.
Right. We basically that's our role there. So that's so the team is there.
Doctor Yeda say with the Aduful say you go so aye twetwe enkomo na ene ye kasa baby bia will be an WTV consulting room. Yene esum bebre and ye domo for the love you always show us. And ye can't about stroke. And now we are discussing the role players in the care and management of the stroke patient. And to say a bia or be odofu be in your stroke. Dr. Patrick say, and you won't and now yes, you have a 50% contribution in it, but the rest of the 50%, you know, a other solid team. And a boy senior beya will home to me at all and at least so that you can reinstate yourself back into your routine and I say your normal life. Na enche ye besa back na ye ba ye the telephone lines, you know, to ja or person send WhatsApp, or person offer or person share or experience a game and I say you send a message on via Facebook, baby Biara you want to, whichever handle you want to use, you can do that and I would read it out and Doctor is here to answer your questions. Senior Beya, Yenara Benya, and Nuyi, and then see Onyankopon on shall mount Naira, baby. I will be a drag before the sin and say, I've been by us. I made it a Jimmy bus school. I know what share me, Onyabi, shall be brave. Any baby, a movie I Messiah by just in a minute. God bless you.
Yen church Jumedia Sronko, Methodist Yasha at the Airbreb, in church soon ye besuya adie, afa, the nim efanyang coupon, yes to Christo home, Kong, and a sunny to ye Gidiamo anamo. A bepens and pens ye Gidiano fappem. Yen church, ye be pisa, ye besuya, na ye be home. Kayawe, na yen suya the our yen church, yen church, ye ma Gidiano adaho pepe.
Therefore, Adia Chimbio, your call ye na so, your could die, a radia dumunti. Ye sorry. And my fra call Musuku, a Jumai force so call Omunumaso. So soon da you, so one soon da you, ye catch sorry, na shrink. Sorry, na shrink, Jumedia, no pabusu, Jumedia bia, ye de brain, said ye bear, ye bet me. Na yenyi ohunamu nempo etimi yenyini ewo adwene mu said ye beya yenyina betimi akyekere oman na ya kyekere asafo na afie kra yetimi akyekere busua
ye behwe nsem a enkoso wo oman Ghana mu eni wiase afa na nyina
Yɛbɛfa nsɛm yi afi kowa nkrataa mu ne abɛɛfo internet so.
Anapɛ bia yɛde nsɛm a ɛma anidasoɔ ne nsakyerɛeɛ ɛbɛbrɛ. Yɛde Onyankopɔn asɛm bɛbrɛ na yɛahwɛ so de abɔ yɛn bra. Afei ka yɛn ho anapɛ bia na yɛmfa anigye nsɛm ɛmbrɛ.
Ɛno nti afei ka yɛn ho
Anita Akwago
ɛne Reverend 𝗥cie Vincent Adomenu ɛwɔ Wesleyan TV so. Afei wobɛtumi ahwɛ wɔ WTV Ghana ɛwɔ Facebook so. Ɛna afei Wesleyan TV Ghana ɛwɔ YouTube so. Sorry na shine.
Wake up to a purposeful day.
Dwumadie aboafo bi te sɛ
All Insurance, multi-credit savings and loans.
Ana Methodist University Ghana ana asɔ yasene.
Meye mi fie Christian fie Mema mi kun aye Christiani Na me mofra aye Christian fo Mema mi fie aye Christian fie Ban papam eye dwumadi a ekoso ewo WTV so Ekasa afa ekwaya ye tete ye mofra Ekwan a yɛbɛfa so ama yawareɛ ayɛfɛ ne yawareɛ adimu. Efie entiteɛ anaasɛ efie siesie ɛne efie nkɔmɔdie mu nso yɛnya ɛnto nkyɛn. Ntumi to nsa frɛw sɛ hwɛ WTV na nneɛma pa bebree ɛwɔ WTV so. Enwumpa, nkɔmɔdie papa, nneɛma pa ɛbɛboa me ne omienu ɛne yɛn fie. Kɔ so ara na hwɛ WTV.
Aduful, 𝗟𝗜𝗩𝗘 say multimedia but like I promised you, say your back, I would just share with you our contacts. Say I mean, some more than that, but say and then first time I want to share with you our contacts so that you can call and share your experiences, ask all your questions into your lines. No, A025-625-3461, 025-625-3461. And that's a 053-835-0625. 053-835-0625. Enti ubetimi afre our lines. You should ubetimi send the WhatsApp. And that's say audio person will send the producer line across. We're busy. Now person offer through that one. You can do that and we can get through to you. Even if you want to send me personal one, I'll also read them out to your doctor Ewo Hase, and he's going to assist us to address all your concerns. Enti yasan baba Dr. Emra ye hwe kwan na ye ne omo interact no na mesre ebisa say let's look at the aspect of interventions. Enti we're looking at the treatment modalities na ye share if there are some complications so you can pick the treatment modalities with us.
So first make us say the type of stroke, and as a stroke no determine the type of stroke, determine your treatment approach, how you be nipa chrono time obeba and so influence it. Inti first of all my main share here with their intimacy no depending on time obeba no ye to me nani adena esintininim no with a draw. Okay. Ana yetumi se baby ebesi no yetumi koyi ntoano moja ntoano ho no yetumi de yes some intervention ye
Dr. Ansana Betwa sama memfa yenkonta kwa de embra. Hello Auntie Evelyn.
Hello.
Yes, Mama Evelyn. Pacho, good evening. We dear Yamawa Kwaba. Why dear?
Me we no ye me CSTV. Hello.
Yes, Ma'am. Pacho, you.
Hello.
Hello, Mama Evelyn.
Yeah, me CSCB na CS no. CS na yeah no. Yeah no. Yeah CS no. Me honam nyina ya na ye digiri. Ewo na me nine na me say na to aso sa me da na me try edudu. Me nine me sa na me nine ba kwa edudu. Nti sa me sorry na me tintin wa na.
No way.
Okay. So I am a metu. They say na dia na e pese ye. Oh, so e bi sa ya si CS na ye me Bruno na ye pesa.
Okay. Mama Pacho, uba na ewu ni enya busme ya he. Mama Evelyn. Mama, na me bi se there surgery na ye how many months ni?
But it's not 6 months.
6 months. Mpocho you. Enti Dr. Bema will advise yeah that's be there if okay. Pacho we did not fancy for now be there. Yeah ko Elvina yaba. Hello. Hello Mama we ni Fred. Mpocho Elmina for hot then.
Uncle Penat will be away.
Yeah there are that's Mpocho ye too.
Mpocho no BP.
Okay.
I check almost 10 years. No may grow be all right. But by 1 month. Me to me she me sana. Me veins na elfi me niechi ba machine side. Na I sorry na me me sa to so was about pim. Inti eya na me suspect say bia symptoms of stroke. No na pese doctor na man. Because with the mensaka, it sometimes wait to me peja. It is a minya rubber more dimpa, nam the I robo. The enemy the rubber my free kaka. The person beside doctor say symptoms of stroke.
Na mo pacho edi fia he. Okay, yeah that's it baby. Doctor Bema wa no ye. Okay, inti Dr. Pacho between yakodo.
Okay.
Yeah, so we can address their concerns and then we come back to our question.
Okay, so Mamina postnatal.
Yeah, sure.
Yeah, I think also 6 months.
Also, in 6 months.
So
yes.
6 months postnatal. Okay, so our postnatal crown and see. I think I don't know somewhere. I don't know what type of. Anesthesia.
Uncle Paul Hello, Uncle Paul. Hello. Yes, Eja. Me patro share my phone to say.
Well, Namia.
Yeah, there is. Patro it you. Dan patro be to me ama one so my kakra.
Implication was
hello.
Who said
hello, Daddy Paul.
And then about because right.
Dan patro obe to me ejina ye ama yen kakra. Mr. say Uncle Paul, patcho bet me jina ye amayen kakra. Right. Enti ye best say Uncle Paul best na afre biom na yitime ate enkomo ne ye. Enti hello. Hello, Auntie Albie. Auntie Alberta. Okay, better, yeah.
So, with your postnatal.
Mr. Arasa say wofra no abomodiama o volume no the television my volume no emra from na yentime ndi enkomoni. Thank you.
Mama na wawo 6 months no etwem no. Minim the type of anesthesia if it's spinal or general. Symptoms no expressing more of
Patrick Yanko Obwasubra. Hello, Mr. Abaje.
Mr. Abaje speaking.
Yes, good evening.
Fine.
Patrick Obwasufo, what to say?
Obwasufo, who boko?
Yeah, the radius in Patrick Dietio, yeah, that's a friend.
Problem na me kwaye operation bi wo. I hope
That's why you call your operation.
I really appreciate the case. Bibi no when me na etiti ya na me titi mo etiti. Pare bi san o mo ke number. Enti that numbness no into my one madra ya ko afini e ko no me ko review but la
Numbness no.
no say sura me what to do.
Okay.
And I see the problem on to.
Okay. Into daddy can about numbness from after a surgery or koye. But then pacho ultimate kai surgery crow yeah. Okay.
Prostate.
Okay. That pacho yeah. Thank you very much, Papa. Into Dr. Becca who has na any na diet that's bebre. Pacho ye call ahonjo aba na hello. Yes.
Good evening.
Good evening, about Pacho mo to say.
Yanko Pradum na Pacho so e.
Adom na ni cry hase.
So from Pacho my question here this we see we have back pain. Ewo we chika se ne pa. Anase wunya head wuti so timi ya we ya pa. Pacho mpese me bisa no kra na say ya no kra. Who draw? And I say, no, confirm whatever Bablo.
Me patcho me that say. But one hour, yeah. Right, thank you. Right. And at least we have quite a few to address.
Yeah, so with the come I now what was 6 months ago, no. So when I make first make I say I don't know which type of anesthesia or yes here one a panel on a chi and I say a man or general. Usually now we do I think they do more of the spinal. So usually they have this post spinal syndromes with headache, numbness, a little bit tingling sensation under their feet. Their head become very heavy. Some people can even get neck stiffness.
Should it take that long? As long as 6 months?
No, for her, I don't know how stubborn she was. Usually some people when they after that they'll be moving their head and I really don't know.
During the
process of the procedure, they want to see. Someone will raise themselves to see, move left, right. The anesthetist will maybe inform her she will be calm. And I don't know which anesthetic drug.
Uncle Paul Mrabio. Hello, Daddy Paul.
Hello.
Daddy, that's a say we now but transfer back and patriote you.
And I'm driving. Then last week, my prep, they up to me up amount of you had what the and I'm just and on a med.
The pattern will say implications. I war is it a drone no honum and I didn't get something too clearly. Okay,
for the pressure.
Dan pacha also we dey mesre me bisa kakra line mo nye too clear but we don't want to lose you again. It's na me bisa say we say wo pressure and na yama wo ehun eduro.
Yeah.
Okay.
Actually I'm right. And I right. The hospital.
Okay, Daddy. Hello, Daddy. Dami Pacho, I would want you to leave your contact with the producer. Yeah, yebefrel na une Dr. Acheche and Komo. Why? I think that line is not too good. Enti yente wonke ye, but we don't want to say beja why ye no enchichen komo. It's why Pastor yesa my Yamisha. Okay. Hello, Auntie Felicia.
Hello, good evening.
Good evening, Mama. Good evening, Ma.
The problem is there. But the problem is there. My hospital, I'm to go BP. The police for our but I want to I me try the time on the side to the one set me. The better me with a post of something to another day.
Me Patrick. Ma Patrick, what did fear here? 45. Okay, me Patrick, you. Yeah, that's a baby. Doctor Bema and MY. Okay, it's right. Me Patrick. You beat me, Ama or Momoy, and we take the second sense. Right, I know.
Yeah,
sometimes I call
no problem. It's good. It's good that people are listening, and it's a good platform for us. So we are back to the woman again.
So the surgery.
So I think she really needs to go back to see I think now they've got because it's past 6 months, it's no more an aesthetic issue because he has passed it. So I think he just needs to visit the person and make these complaints, and they have to revisit.
Is she going to see the surgeon?
No, I think she needs to just go to a hospital they need more information on her.
Okay.
Yeah, so either it's from her. As I said, people have complications. Depending on the drug they even used for the surgery can give them the anesthetic drug can give them the CNS issues. Yeah. And yeah, so she really needs to go back. It won't kill to even do a CT scan too. It doesn't matter because her symptoms are sure it's not any issue. So yeah, for her that's what we can do for her. There is our mother who has the headache with. He says that the veins are at or feeling so
she says she's hypertensive.
She's hypertensive too. Yes. The way all describing it looks more of a different issue. It's no stroke. Either it's a headache. Headache to me your type of headaches.
Exactly.
So either he's just having a very terrible type of headache, or there's another issue we brought for kind of temporal arthritis. Your temporal, you even know what saying to me have some inflammation. Was cap no munina show and mouth in your yapa. So he really needs to see a physician to talk to. We will need more history and maybe possible do some investigations and rule that thing out. If we were able to do that, we'll see what we can help. I think what he's describing affecting the eye. I think maybe if when she's chewing, she'll feel a lot of pain. It comes with
pressure.
Yes, the vein there gets inflamed around our scalp. So people who have those things, what she's describing looks more of a temporal arthritis, just from the few things she's saying, which is can give you a terrible headache. So he will need to see a physician to take more history. Then her pressure, I don't know if it's well controlled. Yeah, she looks like someone who's educated. So I think he should let us know how the pressures are going, and if the pressures are fine, then we should rule arthritis out. You just need some steroids and you'll be fine.
Okay. Right. Papa, with the answer now, you better also with your papa or Frey also surgery and like prostate surgery. No, let me pick somebody from Takwa na.
All right.
Yes, hello.
Good
evening. Good evening, Miss _A'c. Mpacho Takwa for what to say.
Oh, yeah, me not tomorrow.
Yeah, that's so afraid. Yeah, that's you.
Yeah, Mpacho. Of what can stroke, types of stroke. Na situation here, no problem there, no.
Okay.
why the Mocha CT scan, na Mecha MRI. Na why had a spondylosis. Me one neuroform womb. There were with a spinal cord. Intimatum donason or the type of the stroke. No, I'm working impairment.
Right.
And I'm to mental and body sensations. And that is what I want to know so that the help that he can offer advice.
Okay, Daddy. Pacho, yeah, that's it. Yeah, 18. Pacho, I mean, come back to Uncle Patrick. Hello, Papa Pacho, yeah, that's it, baby. Hello, Uncle Patrick.
Yes, sir. Yes, madam.
Yes. Good evening.
Pacho.
That Pacho, online him when yet too good. Better a reposition of who I'm Kaka.
Hello.
Yes, Papa. Pacho, no, yeah, bet me, Jina, yeah, ma'am. Ebia san, Ujam Biano Kakra, ma'am.
Oh, Martin, but
okay.
But your mission, not yet, no bubble.
Okay. Okay, Daddy Pacho, you better a cat's line and not afraid him, Buma. I obey way better. Hello, Auntie Esther. Hello, Mama Esther.
Yes, sir.
Mama Pacho, yet you more to say.
You Pacho, no program.
Yeah, that's the baby.
Yes. My doctor Esther, now, okay, o cholesterol cholesterol nso etumi kɔ stroke na nka mi pɛpɛ sɛ doctor sɛ mesrɛ no ɔnkyerɛ me na sɛ o cholesterol cholesterol ade aduro no na ɔbɛnom anaasɛ aduane pɛn na ɔbɛ avoid ɛne aduane pɛn na wobɛdi timpɛsɛ nka doctor ɛkyerɛ me kakra na mi
Pacho, yeah, that's the baby. Okay, dear. Pacho, we can. I think we can quickly address them.
So for our daddy with the post-prostate surgery, I think I don't know the prognosis and how the prostate was. Just malignant na or have usually prostate need to be called untinimu. And symptoms not described, which is not related to stroke. A bit to me possible to say prostate no very be say na cancer your baby a cancer say to me free baby a one call baby foforo anti cancer am one bit to me and say bit to me akọ adwini mama wonya some there's some effect like that, so it to be very advisable say I don't know, about the clinician or yeah, no man who if maybe they are doing palliative, maybe they've cancelled that this is what is going to happen. So maybe I don't know about the man symptomatic treatment and that's all called the woman drone say beko. So maybe they are doing symptomatic treatment. I don't know the details, but on call back non cancer, maybe they can repeat a CT and see if that's gone back to their brain or something, and they'll do usually radiotherapy and other things that they'll do to help. Right. Yes, and nearby maybe I could be also say CS or see
which is no what we has to do with what say a lot of times can't about those complaints.
Yes, headache or no more of headache.
And then for her, I think she's not had the surgery yet. It is fear of what people are saying.
Right,
and then we had somebody on spondylosis. He had the issue of spondylosis.
The MRI. That did the spondylosis. Yes. So for spondylosis, yes. So I think he needs a neurosurgeon. Yes, they usually deal with that. They can give some, I don't know how curved or there's things are the vertebrae
effects on
so he really needs to see his neurosurgeon to advise him on that.
Okay. Doctor, with the just in a word, what would be your takeaway for your clients? Not just in a second, because we have less than 1 minute to go.
All right. So takeaway is
we'll catch no.
Stroke is a very complex disease, and me per se omofa we ko yewo say obi hu say na ho adwojo ne fa adwojo no nenim okasa nenim achia ana say neni su bri no ana say okọ afafa misrew fa phone na frɛ yen be fast near one thing I want to go out there. And that's what I can say.
Be fast. Phone now, and Tamara. Patronal can say 112. So for a crying and now you bet you know the back now.
And I bet ambulance.
And I say ambulance so a beboa. Ain't baby I will be a person that must be brainy teacher me seniors the first years, me colleagues and second years, ne final years ye probationers are yen I shame Mercedes University. Nyankopon onshira munyina for the love. It is massive. Anywhere we feel the biara da unya emre editie ye. Nyami insha bebre. And me Q say we are so grateful for the good job you keep doing. Nyami insha obi biara and that me mpai bana say because na yetumi atsana ne hu ne was ye se ne be ya ye betena ache. Enti nyame adoma chena kai say eyukesi ada. Boboda anako asori ko som nyame na ina ye nshira onyankopon woni done ne banbo ho. Nyame ye adoma enne na woche ye besan abebio anase ne na woche yes next week we shall be here again by God's grace at 4:30 through to 6 p.m. na enne de ye kanasa enne na unyaba Rose Aduful na enne so ye de WTV consulting room abremo nyumo ajobo mawo na ira apekakaka ede leka de wahidu onyankopon onsha baby it will be God richly bless you. A lot of love. God bless you.